The COVID-19 pandemic has had a devastating impact on the education of children from poorer backgrounds and is widening the gap between rich and poor and boys and girls. In the years since the pandemic was announced, the most vulnerable children have disproportionately missed out on access to education, healthcare, food, and suffered the greatest protection risk. Now, to discuss this, we joined via Zoom by Divya Naidoo from Save the Children South Africa. Good afternoon to you and welcome.
Thank you, Colin. Good afternoon to you too. And it's Divya.
Oh, Divya. Okay. Thank you so much for correcting me. I'm going to get it right next time, Divya.
Yes.
All right. You know, when we look at 2020, one would imagine when the lockdown was announced, children were not used to staying indoors, not going anywhere. And we're talking about being in closed spaces. And children not understanding why and not understanding what COVID-19 or coronavirus was at that time. How do you then contextualize the impact of that on their thinking processes and just their mental well-being?
Yeah, I think, if we start off by just looking at how we as adults responded, what happened to us a year ago on this date when we first heard about coronavirus had arrived in South Africa, the fear, the concerns, the worry that we as adults felt. So can you imagine for children how that is as well? Save the Children did some work where we did some research where we asked children exactly what they were feeling. And some of the main things that children highlighted was the fact that they were really feeling very scared. They were feeling worried about several things. They were feeling worried about what's going to happen in terms of their education. They were feeling worried about what's going to happen within their families, because financially they knew that it was going to have some implications, to the point of some children even requiring psychosocial support and help. But children really felt very scared and worried about what was going on.
And also, the impact of their behavior and relations with their parents. You can imagine the stress that a parent would have if a child wakes up in the morning and wants to get up, brush their teeth, put on a uniform, and get in the car and be taken to school or wait for the bus or whatever mode of transport, and saying, no, mommy or daddy, I want to go to school. And they told, you can't go anywhere for almost the whole year. So now let's talk about that on the issue of schooling, because I would take it that one wouldn't have looked at the notion of reading books, listening to the teacher speaking, and they have to learn online, and some being exposed to that for the first time, the problem of acclimatization. How would you interpret that?
Yeah, you see, I think also we must remember in South Africa, the children are not as advanced technologically because we don't have that kind of resources. So the most children have is through their cell phones, that they have access to, most children in the country, through their cell phones. So this whole new way of having to learn online has been a real struggle for children. And the struggle has been for several things, is that yes, there are children who are able to have laptops and who have cell phones, but we also, through our work, we have realized the large number of children who don't have even access to a cell phone to even learn. So, and we discovered that because Save the Children provided data for children so that they could access online learning. But we realized that there were still a lot of children that we were not able to reach because they don't even have these devices to use, so that they can access online learning. And so this added to the stress and the burden for children. Within families also, remember with several adults, breadwinners in the homes, they either lost their jobs completely, or some of them, their jobs were cut back. And so as a result, the earnings dropped and the income in families dropped. So when they had to weigh between data for the child's education and food for the rest of the family to survive, it's obvious what they're going to pick. So education was not seen as a main priority. And that's where we stepped in and started to look at if we provide this means for children to access. And what's quite wonderful is that as the matric results came out, children were then informing our staff at Save the Children, and we've received very positive feedback with children passing their grade 12 with bachelors, which means that we provided that opportunity and contributed to these children having the opportunity to be able to have some kind of learning. But there are a large number of children that we still feel very concerned about who dropped off school along the way because they could not. And so while some of them may have gone back this year, but they lost the whole of last year because they dropped off. And even when schools reopened, they did not go back to school because they had missed out such a large portion of the year last year.
And then how have you assessed the issue of poor families having not had the opportunity to send their children to school, especially those that did not have access to grants, and then the issue of school feeding schemes really alleviating the pressure of hunger of those who did not have proper parental care for them to be fed 3 meals a day?
Yes, they were, again, we in the study that we did early in the year where we looked at what was the impact, and we found that food was a major concern within families. Now, you've got to bear in mind that a large number of children leave home in the morning, they go in, they're having a meal at school, which is quite often the major meal that the child is getting. With the whole family being at home, this has meant now that the families had to provide meals for all of them, for everybody that's in the home. And children then were often left hungry, and they raised this as a problem that they did not get full meals. And while there were food parcels, like Save the Children also had given out food parcels during that time, it was found that it was often not enough. Because sometimes the family composition was made up of a certain number of people, and then during the pandemic, other family members who were out in other areas who had lost their jobs came in to stay with the family. And so family sizes sometimes unexpectedly grew during that point in time. And everybody being home meant that more meals had to be provided for the family. So this posed a really big problem, and food security was one of the biggest problems that we saw during the pandemic. And children got really affected by that a lot because they missed out. So while schools then subsequently started to open up and meals were provided, not all children went back. So those who didn't then were not able to access the meals. And during the time when schools opened for meals only while they were still closed, parents sometimes felt very concerned to send their children to school to get the food, the meals that they were supposed to have received in schools. So there were so many factors that just kept affecting, and that added to the stress and the burden for the adults and for children in families.
All right, Divya, thank you so much for making time to speak to us.
Sure. Thank you, Colin.
All right.